mental illness was thought to occur through demonic possessions, religious punishments, or considered to be a personal problem, and that as the Middle Ages approached, a person might have been considered to be a witch, village idiot, town fool, or could even be killed for their mental illnesses. One of the first treatments came from Hippocrates in the 5th century BC. He was one of the first to treat mental illness not as a religious problem, but from being caused as the environment or a job that the person had. Religion was still considered to be one of the causes of mental illness up until the Middle Ages. During this time, bloodletting was a popular treatment. Bloodletting was where a human was cut or drilled into to release a humor. These humors were blood, black bile, yellow bile, and phlegm. If one humor was in too high of an amount, the body would be cut into to remove the amount of it from the system. Balance between the humors would be restored. Other treatments involved exorcisms, being starved, or being beaten in hopes that it would get the spirit out of the body. In the late 1700s and early 1800s, three men, Rush, Tuke, and Pinnell, made the first change in the treatment. The idea at their time for the mentally ill was called the Age of Confinement. The mentally ill were locked up. Pinnell, Rush, and Tuke would change this idea into what would be known as moral treatment. In 1792, Pinnell decided to unchain the mentally ill from their beds. The mentally ill were also kept in basements at the time, and he decided to take them out. The idea at the time was that the mentally ill were criminals and incurable. However, Pinnell believed that if they weren't treated like prisoners, they could be cured. They would need to be sent out to the right place, what we know today as an asylum, where the mentally ill would have food, lodging, and treatments all provided to them. He published a book in 1801 called The Treatise on Insanity. The book would offer the basis for how the French, which Pinnell was, would shape their treatments towards the mentally ill. Dr. Rush introduced moral treatment to America. In the early 1800s, at the Pennsylvania Hospital in Philadelphia, Dr. Rush tried to do the moral treatment method on those who were mentally ill. This hospital was the first to do so in the country. Tuke was an Englishman who believed in similar ideas to Rush. Tuke wrote a book called The Treatise of the Moral Treatment of the Insane. He also, in 1796, founded a retreat in northern England for those with a mental illness, and treatment was provided there. By 1847, 30 asylums were operating using moral treatment as the standard. The first state mental hospital to open in the country was in 1773 in Virginia. The next state hospital to open would be in Kentucky in 1822, almost 50 years later. Common causes for women to be considered to have a mental illness, known as female hysteria in the 1800s, were anxiety, postpartum depression, pregnancy-related sadness, menstruation-related anger, chronic fatigue syndrome, and disobedience. Some of these reasons are mental health related today, but not all. Once a woman, or anyone at this time, was found to have an illness and sent to an institution, they were there for life. There was no escape. The most famous mental health related person at this time was Dorothea Dix. In the 1840s, she began researching the mental institutions. She had interviews with the patients and staff to find out what it was like in an institution. She tried to convince the politicians at this time that they needed to propose a bill for the mental institutions. From 1847 to 1854, she tried to propose the 12,250,000 acre bill. This bill was a federal bill that would allow federal land available to be bought for the sole purpose of mental hospitals. It did make it through Congress, but failed at President Pierce, as he felt mental health was an issue that was a state issue and not a federal issue. Her case was not all for loss, though, as 32 hospitals did end up being created for the mentally ill. These hospitals would follow her idea, where patients lived in the hospital and were treated by the professionals. Today, we call this inpatient care. Dorothea was not the only girl to write about mental health in the 1800s. In the 1880s, Nellie Bly decided to go undercover as a patient in the facility. She wrote about her experiences in a newspaper, thus gaining some more publicity about the conditions. Moral treatment was the current method of treatment from the later 1700s through the 1800s. However, these centers were made to be smaller. Between 1850 and 1937, many facilities started to fill over capacity. Something needed to be done to combat this problem. The solution was the mental hygiene movement. The mental hygiene movement was considered to be a more humane way to treat the mentally ill. The movement was led by Clifford Beers. In 1908, he wrote an autobiography about when he had been institutionalized and the treatment he had received. Nothing was done to cure him while he was there. If a patient was able to take care of themselves more, they were often left more alone and received less treatment. And those who required more staff care would be more often abused. His idea was not to eliminate the asylums altogether, but to eliminate the abuse found in them. Beers helped states develop their own mental health associations. The first one was founded in 1908 by Beers in Connecticut. In 1922, the National Committee for the Mental Hygiene released their 5-year projection for child guidance. Clinics would be set up with most in the larger cities. They would treat emotionally disturbed children. By the end of the 1950s, over 600 children would be treated following this guide. Some treatments done during this time were insulin-induced comas, lobotomies, malarial infections, and electroshock therapies. Deinstitutionalization occurred from the 1940s to the 1960s. In 1946, the National Mental Health Act was passed. This was the first time a major federal law related to mental health was passed in America. The law created the National Institute for Mental Health. The next year, the community mental health movement took place. Home care and outpatient facilities were now available to be used. While some of the previous treatments, like lobotomies, were still being used in this era, a new treatment was being used: medications. If people were treated with medications, they could be treated at home. Pairing nicely with the home care that was now available. Another reason for the use of medications in this era was that this era had the highest ever amount of people being institutionalized. By allowing some to take medicine at home, it would decrease the numbers in the facility. A main goal in the 1950s was to move people out of the institutions and back into the communities. The communities, however, were slow to adapt to what all the patients needed. The communities did not have proper housing assistance, job training, psychiatric counseling, and social support. Since the communities were not able to adapt to the patients did not end up receiving a better life than they had in the mental hospitals than they were in before. The Mental Health Study Act of 1955, created by the Joint Commission on Mental Illness and Health. In 1961, the Commission calls for a change to be changed for the mentally ill. This message is heard by JFK. President Kennedy in 1963 gives a speech to Congress for what he called a bold new approach. And this was the first time the president ever addressed mental health or mental illness. The 18 years after the speech, over 760 mental health centers would be opened. The court case, Wyatt v. Stickney, in 1972, established that patients have the right to be treated in the least restrictive setting. It also set adequate living standards for living in a facility. Multiple groups emerged for mental illness during this time, including the National Alliance of Mental Patients, Network Against Psychiatric Assault, and the Coalition to Stop Institutional Violence. The number of those in a facility decreased from 550,000 in 1955 to under 200,000 in 1975. Multiple programs were created in the 1970s, including the Community Support Program and the Mental Health Systems Act. However, in 1981, President Reagan would reveal his tax cuts, which would cut funding to these programs, amongst others. In 1988, 28% of all homeless people would be those with a mental illness, and by 2000, there are only 22 beds in a state hospital per 100,000 people. Residential treatment centers still exist today. While they may not be as plentiful as in the past, they were not completely eradicated. One such example is the McLean Hospital in Massachusetts. To stay, one must be an adult, 18 or older, and have a diagnosis of a severe mental illness, like psychosis or bipolar disorder. The patient must also have what is considered a co-condition, like a substance abuse problem, personality disorder, or an anxiety disorder. The final requirement being that the person wants to learn how to live independently. An average stay in the hospital would be 2 to 3 months, though they can stay longer if needed. The hospital also has psychiatrists, social workers, nurses, and therapists around the clock to care for the patients. Patients are treated on a 5-phase process. These phases have the end goal of getting the patient to function and work in society and provides the necessary follow-through to make sure that their needs are met. Group therapy is also a requirement, with up to 20 sessions a week offered, as well as more holistic treatments like yoga and meditation. Those looking into this treatment will pay $700 a day. For a 3-month span, that can be more than $60,000.